We understand that a lot of you are unsure of what Medicare is, even those that might already have hit that magic age of 64 and a half when you become eligible. So to help fill in the blanks, we'll be covering the ABCs of Medicare. And while we're at it, we'll throw in the D too. You'll see what we mean. Let's start at the beginning. Medicare was passed into law in 1965, the year that Bob Dylan went electric, and a gallon of gas ran you a whopping 31 cents. It was created to provide healthcare insurance to Americans upon reaching the traditional retirement age. Today, Medicare breaks down into 4 pieces: Parts A, B, C, and D. Pretty simple so far, right? Part A is universal for all Medicare-eligible U.S. citizens. This helps to cover your hospital services, hospice care, and some skilled nursing facility costs. This is helpful if, for instance, a coconut falls on your head while you're on vacation in Hawaii and you wind up in traction. Okay, bad example. Anyway, in most cases, Medicare Part A doesn't cost you anything. Part B is also universal for all Medicare-eligible U.S. citizens, and it covers visits to your physician, as well as outpatient care at hospitals, clinics, and labs. When you have a stomachache and see your doctor, and he sends you to get an X-ray, that all falls under Medicare Part B. Together, Parts A and B are sometimes called Original Medicare. If you have Original Medicare, you may also opt to choose a supplemental insurance plan to pay down some of the costs that Part A and B don't cover. This is important because Original Medicare also has something called an 80-20 split, where Medicare covers 80% of your costs, but you will be on the hook for the remainder, no matter what. Meaning, if your hospital bill comes to $100, you're responsible for $20. On the other hand, if that coconut from Hawaii puts you in a coma and your bill runs up to $1 million, well, you get the idea. We'll get to Part C in a second, but first let's take a quick look at Part D. Part D is for prescription drug coverage, and it is purchased from an insurance company because the government doesn't provide this kind of coverage on its own. Once again, users often purchase supplementary insurance to help cover this cost. But here's the catch. If you don't sign up for Part D during your initial enrollment period, you may face steep penalty charges from the government. This penalty is calculated monthly for each month that you do not have creditable drug coverage, and it is not a one-time penalty. In fact, you will most likely have to pay this penalty as long as you have Medicare. And because it is based on a yearly calculation, it can even go up year over year. So be aware that not signing up for Part D when you become eligible can cost you a bundle later. Now back to Part C. Also called Medicare Advantage, Medicare Part C combines your coverage for doctor visits, certain hospital costs, and other services from Parts A and B into one neat and tidy health plan that has your health needs in mind. Medicare Advantage plans also offer extra benefits that you wouldn't get with Original Medicare alone. What kinds of benefits? Things like $0 preventative screenings for breast, prostate, cervical, and colorectal cancer. There are all sorts of optional add-ons too, including dental and vision plans, and much more. And remember Part D? Well, another great thing about Medicare Advantage is that some Part C health plans include this coverage at no extra cost. And that, in a nutshell, is the ABCs and D of Medicare. To learn more about Medicare, including your options for Medicare Advantage, check out www.care1st.com.